Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we have the pleasure of speaking with Patty Donley, who is the Senior Vice President and Chief Nursing Executive at WellSpan Health, and we're going to talk about WellSpan's virtual nursing strategy. So, hi, Patty, how are you?
Hi, G. I'm great. Thank you so much. I'm really excited to talk with you today.
Yeah, of course. Thank you for taking the time. And this is a great topic. Virtual nursing is rapidly becoming a standard of care in nursing. So I'm excited to get into WellSpan strategy today. So, what were some of the biggest pain points that your health system is trying to address by implementing a virtual nursing program?
Well, G, I think it's really twofold. I think first and foremost, as we look ahead, healthcare organizations across our country are evaluating the headwinds that we're likely going to be facing. And I
Mhm.
think in particular, we're all really keeping a close eye on what will likely happen as our baby boomer generation ages and will likely need more care at the same time that our baby boomer and healthcare professionals really are retiring. So,
Mhm.
what we're predicting is that as our nurses retire, and the rate that we're predicting that they will retire is likely at a greater rate than those entering the profession. And that combined with that increase in the number of aging adults will likely create a supply and demand issue. And I think, we're really trying to look ahead and determine how do we plan now for what likely will become an even greater shortage moving forward. But I think in addition to that, we're also looking to see how do we support the nurses today in
Mhm.
their workload and the work that they do and do it innovatively and in a different way to hopefully provide greater satisfaction to that nurse at the bedside.
Mhm. Absolutely, and there's the thought of maybe using virtual nursing to as like a mentorship platform or program for younger nurses as well with those tenured nurses. Is that the idea as well?
I love that idea. Actually, as we talk a little bit more about our strategy and introducing virtual nursing initially, we didn't touch on that. But I think it's such a great concept to think through how do we continue to leverage that experienced nurse who
Mhm.
may not be able or desire to work at the bedside any longer, but to still leverage that knowledge and that support to our younger nurses or our newer generation of nurses that'll be entering practice. So I'm absolutely interested in how we pursue it in that way too.
Absolutely. And then how long has your virtual nursing program been in place? Just out of
So
curiosity.
we've been in place since 2023, so
Gotcha.
going
Okay.
on almost 2 years.
Awesome. Yeah. So how
Yeah.
did you go about developing a virtual nursing strategy as CNO?
I think that as we look at the strategy WellSpan embraced, it was really looking at it from a cross functional kind of purpose.
Mhm.
So we had that vision, we knew what we were looking to accomplish, but doing it in such a way that we pulled in our IT colleagues. We also pulled in what are really fortunate to have, and that is an innovation and a design team as well as nursing leaders across our health system. So collectively we were able to create almost a governance structure that
Mhm.
leveraged that executive level leader who may have had the vision, was able to build out the budget, the timeline, while also having a committee of just clinical leaders, clinical team members who, initially actually were part of Kaizen events saying, how do we leverage this to absolutely make an impact, a real impact to the people at the bedside? And then lastly, we had the technical team, who looked at all of the technical components that we needed to consider through the strategy. So I think that's what made us successful, and particularly engaging frontline nurses from the beginning
Mhm.
was integral to our ability to, be where we are today. I think that listening and gaining their insight and input into how we did it initially helped us to build a platform and to create a virtual care model that worked for our nurses. So, that's the structure that we embraced.
Absolutely. I love that idea of a governance structure too, because it's so important to have that collaboration between
Yeah.
departments. So I think that's great. Um,
Yeah.
So
And
are
one of the
your
things,
oh, go
sorry,
ahead.
G,
Yeah,
real one other
that's
quick
okay.
thing I just thought of too. The other thing that we started from the very beginning was to message that the virtual care nurse was not meant to replace nurses, but
Mhm.
to support them. And
Yeah,
that was kind of that messaging. And I think it became very real to all of the nurses who participated in those Kaizen events. So that continues to help, I think, with the adoption and our ability to leverage the platform. So sorry, I just thought of that.
absolutely. No, no, that's a great point as well. I think there's a lot of apprehension in nursing
There is. Mhm.
about virtual nursing and also things like AI being replacement. So that's super important for sure. So are your virtual nurses pulled from existing staff or are they hired externally?
WellSpan actually leverages both
Okay,
models.
nice. Yeah.
So, especially early on, one of the things that I saw that was really helpful is we were able to ask nurses who were on light duty or maybe just not able to fully function in complete capacity at the bedside if they were interested. And they were. We had so many nurses very early on that said, I'd love to try this. How can I become involved? How can I continue to work, even though I can't maybe work completely at the bedside? So we've evolved into also offering a centralized model where we have a bit better coverage, 24/7 support at the centralized level. But then within each hospital, we also have nurses that worked in that hospital and now work in the virtual space. So doing it both ways, I think, has allowed us to not only create a productive environment where virtual nurses are available throughout the entire day, but
Mhm.
also really gain insightful interest and energy around people who really wanted to do it within the markets that they live. So
Absolutely. Yeah. And so when the virtual nurses are they working remotely or are they in like a hub location or what does that look like?
right now they're in a hub location. So whether they're locally within the hospital that they've always worked, it's a hub.
Hmm.
And in a centralized location, it's also a hub. I'd love to explore eventually how we can do this remotely to see how we can bring back those nurses who might have left the bedside because they wanted remote work and how we can leverage their expertise in this way. But right now we're using the hub model.
Absolutely. And then I'm curious as well, are you finding any interest among your like new grad nurses to get into virtual nursing? Because I know as a Gen Z member, I'm always,
Yeah.
we love the technology. So what are you
Well,
seeing?
what I can say, we don't have new grads right now working in that, but what we're looking to do is to partner with our area educational, our colleges and universities
Hmm.
to introduce the technology while the nurses are in nursing school so that they could be prepared if potentially that's an area that they're interested in. So, really introducing that technology and the platform and how it's done early on, in a person's career might help to eventually move in that direction.
Absolutely, especially as it becomes, as we mentioned earlier, more of a standard of care. It's got to
Right.
be in nursing education for sure.
Right.
Um, so then, what technology are you using for the program, and what kind of factors did you consider when picking and choosing? Because there's a lot of different options.
There really are. And thank you for asking that question. We ended up selecting Artisite and we did it for a couple reasons. So first off, we were definitely looking ahead. So although we limited the initial use cases with virtual nursing, we wanted to select a platform that would enable us to get to a future state where there were lots of applications and ability to use virtual nursing to solve, many different, problems or issues that we're facing. But
Mhm.
Artisite also was hardware agnostic. So we knew that we could implement it in our different hospital systems where hardware might have been challenged or not, as different hospitals became part of our system, they had different kind of, hardware technology within the hospital. So that was really important to us. It
Mhm.
also integrated with our documentation system. So that was helpful. And then the other piece about Artisite is there is AI components to it. So it's not just a camera system. We like the thought that we could also leverage AI in terms of how we can pick up and look at cues and different things that are happening to help really maximize the
Mhm.
platform that we were engaging in. So those are some of the things that we considered. We talked to people who were using different systems and ended up going with Artisite.
Absolutely. And so is it like mobile technology or is it built into the room?
Both. So we
Okay.
started with mobile technology in many of our hospitals, but we've now integrated the, in-room cameras in many of our sites. I think we have over 700 cameras now. That might include some where we still have mobile carts,
Mhm.
but we eventually would like to move toward the installed cameras in all of our rooms. But the mobile carts are helpful if we're in the emergency department or different places like that where the camera might not, make sense. So.
Absolutely, and I'm curious about the emergency department with virtual nursing. I've talked to a few other executives who are trying to figure out kind of how to implement virtual nursing in the ED. So, do you have any insights to offer about that?
So some of the use cases that we've developed predominantly center on creating, completing the admission assessment. And if we do that within carts in the emergency department private room, it helps
Mhm.
us, to be able to do that with regardless of the setting. Some of
Mhm.
the other things though we're exploring is how do we continue or potentially leverage something like this for patients who are boarding, who are waiting, there are just a lot of different opportunities in how we can do it. But right
Mhm.
now, pretty much it's centered in our health system on completing admission assessments.
Absolutely, yeah. So then, speaking of the future and AI and new technology and all that good stuff, how do you anticipate WellSpan's program to change in the future?
Well, I hope it just absolutely takes off. We're really excited about the platform and how we can continue to use it to think differently and to, again, really consider that bedside nurse and how do we reduce administrative burden? How do we reduce workload that the RN license does not, need? You don't need an RN license to do it.
Mhm.
So I think we have something like 9 optimization cases going right now, another 8 on the horizon to put in place. Some exciting things we're exploring next include the ambient listening and how do we leverage an Artisite platform or a virtual nurse platform for documentation
Mhm.
so that you could speak as you're assessing a patient and we capture it. You wouldn't have to go back and document. We're also looking at a lot of really different efficiencies in sites of care like the operating room
Mhm.
where it can help us capture different documentation pieces. So lots of things happening around this, and the excitement continues to grow, which is great. And that's exactly the position we want to be in as we continue to talk to our frontline nurses and team members to say, what else? How else can we support you? How can we help make your role one, that you can spend as much time as possible with our patients and really provide that hands-on care that we know our nurses are looking for. So
Absolutely, because that's the point, right? It's to enhance
it
nursing
is.
and
It
nursing
is. It
practice.
is.
Yeah. So, my last question for you is, do you have any advice for CNOs who are trying to get started on their virtual nursing journey? Because it can be overwhelming.
It can be. I think if there were any, if I look back and certainly in reflection, you can see some of the things that were really helpful. I'd say certainly to kind of have that long term mindset in play. So you might start small, you might start with doing admissions or something like that, but think about a platform that's going to take you to the next level and that might be able to really solve some future challenges. I also think that absolutely engaging frontline team members from the start is critical. And then
Mhm.
really celebrating the milestones, celebrating the successes. So, very early, as we started to see how virtual nurses were making a difference, making an impact in our care outcomes, we shared that quickly, celebrated them, and continued to build on it as we leveraged the platform throughout, our hospitals. I think that virtual nursing is going to be, you know, uh, I think what you called a standard of care in the future.
Mhm.
So as you look ahead at that, how do we continue to bring our frontline nurses into, really sitting at the table to say, how do we do this and how do we do it well with their
Mhm.
support and with their workload in mind. So, and I think it's been really helpful to choose a partner in Artisite who will work alongside you, willing to be open to use cases that maybe others aren't doing. So they've been a great partner for us to think innovatively alongside. So that's been great too.
Absolutely. Well, thank you so much, Patty, for your time. I'm really grateful
You're
to have this opportunity
welcome.
to hear your insights. Yeah. And thank you
You're
so
welcome.
much
It's
to
been great.
everyone in our audience for listening. Thank you, Patty.
Thank you.